Now, quickly moving to the next discussion, which usually helps in talking about the various methods of diagnosis in orthopedics. And we're actually going to look at, I'm coming. Okay, we're looking at what is known as the synovial fluid analysis. Synovial fluid analysis, right? So synovial fluid analysis just simply have to do with, you're just trying to tap synovial fluid from a joint. That's all. Okay. So synovial fluid analysis, we say that it's a key diagnostic tool. It's used in orthopedics, of course. This is because you want to evaluate joints, okay, and you want to be able to diagnose joint conditions, right? Like all those arthritis, all those infections, all those gout and trauma. So of course you are aspirating fluid from the joint, that's arthrosynthesis. Then you are examining it, you are sending it to the lab so that they can do a lot of things, including culture. So definition is just a group of laboratory tests, and it's usually performed on the synovial joint. Okay, that's to access the synovial fluid and send it for assessment. So purpose is to help distinguish or confirm all those non-inflammatory conditions, okay, inflammatory conditions, infectious conditions, hemorrhagic conditions, right? So the fluid is obtained via arthrosynthesis. That means a needle is actually put in. Okay, so it's when you put in the needle and you get the fluid. The fluid can be like this. The fluid can be mixed up with pus. The fluid can be mixed up with blood. I don't know if you understand. Different conditions can actually find the fluid. So components of synovial fluid analysis is you are trying to examine the color. I don't know if you understand. So it's from the color you can see whether it's mixed, it's just normal or mixed up with pus or mixed up with blood. You are examining the viscosity. You are trying to also examine the volume. Then chemical tests, you can test for glucose, you can test for the amount of proteins, you can test for enzymes like lactate dehydrogenase, which should be elevated when there's inflammation. Then also some microscopic examination where basically maybe you are checking for other microorganisms. Then you cell count, okay? You count cells, okay? That's white blood cells, right? You count the number. That's often neutrophils, right? So you're counting that. You also look out for crystals to see if you have crystals there. Monosodium urate crystals, calcium pyrophosphate crystals. You also do all those gram staining to identify if there's any bacteria there. Then clinical uses in orthopedics include just to diagnose all those inflammatory conditions, okay, and to guide treatment. It will help you know which type of antibiotic would be better for the treatment. Then it will also help you know if, okay, you guys are going to introduce surgery in it or have to wait. Okay, so that's it for synovial fluid analysis.